Okay, it's 8:05 by my time, so I think I'm going to start. And again, just to say thank you, to all of us that joined so early. Precious was the first on the call. Please do keep it up, and turning up early is a show of character. It means you're going to make an excellent pharmaceutical technician and a guru in dispensing. So you're all welcome. This is the second class. We started last week on the topic, the dispensing process. This is the second of three classes. I hope it's been an exciting one for you, like it has been for me, to share on this call. As a way of, you know, I would like to do some recap, just to have a sense of where we left off last week. Can anyone remember anything? So my question directly is for Precious, Debbie, and Rachel. If you could just give us a very brief summary of what you can remember from last week. There is no right or wrong answer. Anything you can remember as it relates to the dispensing process. It would be nice to hear from you all before we start. So, Precious, because you came early, it's not a punishment, but it's a show of goodwill. Can you go first? Anything you can remember from last week conversation on the dispensing process, please share. Hello? Okay. Um, Disclaimer, it has been raining here from where I am, so just in case the network plays a fast one on me, I'm just putting it out in the open. But can anyone confirm if you can hear me, please?
Yes, we can.
Oh, okay. Thank you, Kolo. So, Precious is quite on me. What about you, Debbie? Do you want to share anything you remember from last week? Okay. Rachel, what about you? Anything at all? Excellent. Dispensing helps to protect the patient's safety. You've made my day. You've just made my day, Debbie. That is correct. That is well put together. And thank you for sharing. I'm not sure why you don't want to speak. I would have asked you, what you understand by that. But you're very correct. Dispensing helps to protect the patient's safety. You remember we said that, the technician or the pharmacist is most likely to be the last person to see an outpatient client. Outpatient, I mean people that just go in, see doctor, and they leave the hospital. They're not admission. So the pharmacist or the technician are likely the last people to see the patient before they leave the hospital. So it's very, very important that the safety of the patient is at the forefront, even as the technician dispenses medicines to the patient. Thank you for reminding us of that. Um, Anyone else wants to try? If not, I will just go ahead and, just go straight into a bit of, a recall on the things that we discussed last week. So please remember, last week, we dived into general definitions of dispensing. Please do not forget, we looked at, different, definitions based on international standards. We looked at operational definitions for dispensing. We also looked at within our Nigerian context, what dispensing meant, irrespective of where in the world dispensing. There are four key elements that qualifies dispensing, or it's or yeah, that qualifies the term dispensing and the practice. The first one, we said that it has to be on a legal basis, meaning that for you to dispense to any patient, it has to be on the premise that a prescription was authorized. There was a prescription that came either from a doctor, a prescriber, a surgeon, that you just don't dispense medicines or drugs without a prescription. So prescription, it's in itself, is what legalizes the practice of dispensing, that it's not just off the shelf anyhow. It's authorized by a practitioner, a licensed person has authorized that dispensing. That's the first one. Then the second thing we spoke about is that dispensing, it's a process. Obviously, it's not just about handling drugs. It starts from preparation, packaging, labeling, consultation. Like it's an entire process that needs to be followed judiciously. Dispensing is to ensure that the person you're giving the medicine to actually understands how to use the medicine. Again, like Debbie said, for their own safety is very important. Then lastly, what any technician would want at the end of the day is that the drugs that you dispense is able to give the outcome. That's the therapeutic outcome that we anticipate. So that's that. We also looked at why dispensing matters. We said it protects the patient's safety. We said it prevents medication errors. We remembered, we even had an example that was shared with us, real life example, how medication errors can lead to fatality. We spoke about the fact that dispensing matters because it ensures legal compliance. Then lastly, the fact that the success of any treatment at all lies strongly on accurate dispensing practices. So basically, in summary, that was what we looked at last week. And with that, we will move forward to this week's presentation. So for this week, we're going to look at two things, two main themes. We're going to look at the historic evolution of dispensing, how it started, what is the history behind it. Then lastly, we're going to look at the dispensing process in itself, step by step, broken down into tiny steps, what a dispensing process looks like. So please, can we go to slide 18? I think that's where we have the slide on historic evolution. Next, next, yes. Next slide, please. Thank you. So, next slide. Thank you. So, how did dispensing start? Right, everything has a history. So we'll just quickly look at the history of dispensing. And so, dispensing dates back as back and old as any medical practice that you can think of. Either through the eras of where there were no even documentation, there were no reference points. We know that our forefathers, we go to the when a child is sick, they will enter the nearby forest, or go to a farm, plug a leaf, mix it up, that's called compounding, and give it to a child. Or maybe a child has fever, high blood fever, sorry. They'll go do some leaves, boil, pour it on the child's body, and all of that. Now, even though those were far backdated, but without referencing, without documentation, without articulate step by step, this person is as old as any medical practice. It goes way, way beyond, as far back as 1750, before Christ, or what we can call before the Common Era. And so at that point, basically, there were few rules here, some penalties, they will say, how people will say, if you do this, don't do this, some myth around medicines. And so, some assumptions around preparations, and even, some myth and traditions, that has been passed down by our forefathers. But the point is, at the earliest point, there were no references to medicine, there was no accountability. We just know that, a grandfather would say, that was what our great 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 grandfathers used to do, and was passed down, to them. And so that's how dispensing started. Then it moved, or it evolved into the 17th century. And so by the 17th century, that was when we had the first official pharmacopoeia. And if you've attended any compounding class, you must have heard the word pharmacopoeia, or any of the lecturers that you've had in last week. You must have heard the mention of pharmacopoeia, right? Being the reference document that provides standards for preparation of medicines, administration of medicines, compounding. It provides global standards as well as best practices. And so the very first pharmacopoeia that was developed was dated as far back as the 17th century. Now, of course, with that, there was introduction on, what recipes it should be. You would have to add this to this. Once you have it, you give the child, maybe the child will take it 3 times a day, or no, you take it in the morning, or no, you take this drug on empty stomach, or no, you have to take this one with food. The first pharmacopoeia, provided all of those standards for dispensing and use of medicines. And so from the 17th century, we moved into the 19th century. In the 19th century, what happened was a mass scale in terms of production of medicines, where we had industrialization, at its peak. Factories came on board. The drugs were produced in mass. And so basically, you could have access to medicines without any form of consultations or verifications. And again, it moved gradually towards better standardization within that period. In the 19th century, we now started having institutions, pharmacy schools. We now start having formalization of licensing bodies, putting the profession, in the direction at which it's supposed to go. Then we move to the 20th century. Please, can you go to the next slide? Again, this is to give you, a bird's eye view that dispensing has been as far back as time can be, as far back as medicine in itself. We moved through the 19th century, different phases. We moved from prescription only at some point. There were debates over the legal basis for prescription only and over the counter. Prescription only means, like I'd mentioned, you can't access drug without prescription. Over the counter means you walk into a pharmacy, and they just ask for a drug. I beg, give me paracetamol, and it's handed over to you. All those debate happened. We had the establishment of regulatory frameworks, and eventually even the role of a pharmacist or a technician, became even more apparent within the medical sector. And so over time, as you can see, dispensing has moved from stages. It got to a point where there was a need even for a global reform generally in terms of how the drugs are approved and issues surrounding surveillance for drugs. We'll look at that under pharmacovigilance. But again, this just shows you that the concept and the practice of dispensing evolved over time. Let's go to the next slide and see where we are as at today. Now, having this backdrop today, moving into the 20th century, using Nigeria as a classic example, you would see that we now have regulatory frameworks within the country. We have NAFDAC, we have Pharmaceutical Council of Nigeria, again, all playing different functions to ensure that the practice and delivery of, the pharmacy profession is with quality, it's compliant, and it's ensuring we get the kind of outcomes that we intend to get. Now, where we are today, the practice or the standards of dispensing, it varies. You know, Typically, a typical hospital is you go to a hospital, you get a card, you get to see a consultant or a doctor, as it may be. They take your information, they run the diagnosis. Sometimes you go and do tests, sometimes there's no need, and you get a prescription. Now, there are some hospitals where your prescription is on paper, right? But if you've been to other hospitals, even within Nigeria, they're a bit more advanced. You will see that from the reception, right, from the front desk up until the doctor, you're not holding paper because everything is electronic. You will see that your information is captured on, a computer. They will tell you go to the next. They'll tell you go to the lab. You'll be like, are you giving me? No, your information has already gone ahead of you, right? So you can, once you're done with the lab, they'll tell you go to the pharmacy without a paper. You get to the pharmacy, your information is already, through softwares, your information is already there electronically. And so where we are today, is either a prescription through a note or a paper, or through electronic means. Prescriptions are written and it gets to the pharmacy. And so from there, the pharmacy technicians takes it step by step, which we'll look at in details before the drug is dispensed. Beyond where we are today, one thing I can assure you is that even as this dispensing process has evolved, there are a lot of innovations, and debates that are ongoing that has not even come to Nigeria as at today. Where we all agree with me that we're in the era of AI, right? And so, with AI, there is room, artificial intelligence, there is room for the use of AI, in setting up or in predicting inventory needs. AI can help you sort out the stock, that is the drugs that you have in the pharmacy. That would aid efficiency within the dispensing process. We hear in some climates, where robots are coming into play, and they do some form of dispensing or have potential, to automate the dispensing process. We know that spoken about digital prescriptions. There are even some instances in other advanced countries where the dispensing process, or even the conversation, it's online. Like, we call it telepharmacy, where a pharmacist is allowed to consult, review your prescription, and monitor you completely remotely. Like, you don't even have to meet face to face. Again, these are all, advancements that have happened over time, through medicine itself, and the dispensing practice is not an exception. So, we look forward to seeing how all of those innovations, get to Nigeria, and more importantly, how it helps to improve our systems. So we now go straight up to the dispensing step in itself. So please, can we go to the next slide? Please, the next slide. Okay. Just yes. Thank you. This is a slide I want us to go to. So we're going to look at about 7 steps. See, I told you, remember we said it's a technical process. It starts from step one all the way from to step seven, and each and every step matters. Each and every step matters. There's a reason why we would take each of these steps and see what we can learn from it. Please, let's go to step one, which is on the next slide. The very first step to any dispensing process is you as the technician, or as the pharmacist, you receive the prescription. It looks simple, Abby. You just to collect the paper, or you just open your laptop and boom, you've seen the patient's prescription. But that is the first foundation to ensuring that the dispensing process, you get it right from the beginning. It's in this particular receipt of the prescription. Now, the idea is you receive the prescription from the patient, like I had mentioned, either electronically from the prescriber or directly from the patient on a paper. The first thing you want to do is to check that this prescription is from an authorized prescriber. So either if you're in a pharmacy outside the hospital, you want to make sure that this prescription is from a doctor. It is signed, probably there's a name, that attests, or maybe there's even a stamp of the hospital where the prescription is coming from. So it is not okay to collect prescription and boom, you go and pick the drug and you give. You want to make sure that it is from an authorized person to do that prescription. Even within a hospital, the patient is on admission, you want to be sure that it's either a nurse from the ward or a doctor. You don't want how do I call it, someone, anyone that's not authorized to write a prescription to handle one. So that's the first thing you do to make sure that this prescription is from a doctor or from an authorized prescriber. Now, the next thing you do when you receive a prescription is to check, is this prescription complete? By complete, it means you want to check, is there a patient's name on this prescription? Does it carry the age? Is the person that prescribed it, is it there? Is there a date? If your prescription doesn't have a date, it's not valid. Like it's as fundamental as that. If the prescription doesn't carry a date, it is not valid. You want to see the medicine that is there, you want to see the strength, you want to see the instructions. These are all of the things that validates a prescription that comes to you, that as a technician or a pharmacist, you must check and make sure it's there, right? Then lastly, for example, like, you want to check, you know, if there are some timelines to the prescription, for example, if this is what I mean. If, for example, you see tab paracetamol, you would see tab amoxicillin, you would see tab pyridine, for example, and that is all. You don't see a validity period. You don't see that this is supposed to be taken for 3 days or it's supposed to be taken for 1 week. That prescription is not complete. So these are basic things that you must check on the point of receipt and validate that the prescription is right. Again, once you don't see any of the things that we've mentioned, the prescription is not valid. It's a red flag. Once you see on the prescription, the name on the prescription is Blessing, for example, name Blessing, and maybe you say, hello, what's your name? And the person says, my name is Hawa. You see, there's a problem. The names don't match. That is a red flag. You want to be sure that it is signed. You want to be sure that the quantities are there. And then you want to be sure that there are no major interactions. Okay. So that's the first step. So after you've done all of this, check, it's correct, then you go to step two. So let's go to step two. Good. Screening, clinical check. As a pharmacist or as a pharmacy technician, there are these 7 R's that I remember then in school you literally have to cram those R's. They're we call the 7 R's, right? It has to be the right patient, the right medicine, the right dose, the right route. I think the time, documentation and counseling. Now these are things that you have to check as part of your clinical screening. It has to be the right medicine for the right patient and using the right route. Okay? The name of the drug has to be very clear. It can't be confusing. It has to be very legible. You have to see the dosage. These dosage position, if the patient is unconscious, for example, you can't say the patient should take a tablet, or an oral medicine. Like you have to check, if it is an injectable, put it in the veins or muscles, or an inhaler. You would have to be able to ask if the patient has any form of allergies. For example, me as a person, for example, I react to sulfonamides. So I don't take ciprofloxacin. Once I do, like I just my whole body, I guess like I'm going to go crazy. So it's an allergic reaction. So for example, if you see that drug in a prescription, you want to ask a patient if they react once they take ciprofloxacin, and if they tell you yes, you know that they have to go back to the doctor. So those are the quick clinical checks that you would have to make sure you know as a pharmacist technician. Like an example I gave, if it's a child, for example, within the ages of 5 to 7, and you see ciprofloxacin itself, 500 milligram, you know that it's too much for a child, within that age. The child within that age should be about 125 milligram, at worst 250 milligram. So you know that yes, it might be the right drug, but the dosage is not right for that patient. So these are examples of the kind of checks that you must make on the prescription. When you check, everything is sound, everything is complete, there are no interactions, then you move to step three, sorry. So let's go to step three. Okay, there's a duplication. Please go to the next slide. Good. So we've checked the prescription is valid, is by an authorized prescriber. We've checked the everything, checks the name, the dosage, everything is there, everything is correct. Then we go to the preparation, of the medicine. So at this point, what you now do is based on what has been prescribed by the doctor, you make sure that the medicine is correct and the quantity is correct. What do I mean quantity? If it's an adult and the adult is supposed to take paracetamol, 222, that's 3 times a day, right? That's six tablets, am I correct, in a day? I'm supposed to take it for 3 days. That's 18 tablets in total, isn't it? So you want to be able to put all of that together. You make sure that the medicine is correct, the quantity is correct. That's if you're counting. If it's a card, you want to make sure that a card has I don't know how many is in the card right now, but you want to make sure that the number of cards that you give provides the treatment regimen that would solve that case. A classic example, an anti-malaria drug. There are anti-malaria drugs today that you just take 1 tablet a day. And malaria treatment is mainly for 3 days. And so you want to make sure that okay, it's 3 tablets that are within that pack. So these are just things that you check to make sure that there are no problems, right? Once you already have that, you've gotten the drug from the shelf, you have made sure that the quantity of the drug is correct, Then you now label. Hmm? If you're putting it, if you're you could label it either on the pack. If the medicine already comes in a pack, you can label it either on a pack. It could be on a dispensing envelope, but you must label the medicine. You want to put the patient's name. It's important. Remember, it's a patient-centric approach. That drug is only for that patient and for no one else. So the patient's name has to be on it. The medicine name has to be on it. Most times it's preferred that um, the medical name, is on it. But for the sake of, in some instance, you just put some people put the brand name on it. You understand? So you put the paracetamol, some people put PCM, you put the strength, you put the quantity. It's important you to show how it's supposed to be taken. You must put a date and you must put detail. And lastly, you must provide some instruction. No, take with food or store in refrigerator. These are things that we see, when we go to pharmacy, even on the drugs themselves. Or you could see some warning signs. For example, this drug may cause drowsiness. So what that means is, if you take the drug, just go and look for somewhere and sit down. You don't engage in strenuous activity that could cause any harm. So basically that's how you prepare the drug, and you ensure that it is well labeled. Again, please do not forget, it has to have the patient's name. It has to be written in a simple way that it can be interpreted by the patient. If there are warnings that needs to be provided, please give those warnings, and write down those warnings. And as the technician or the person dispensing the drug, you should sign off on it. Okay. Then once that is done, then we go to step 4. And that is why in sometimes when you go to pharmacy, you'll find that for you, like joke, you're spending 10 minutes there and you're wondering, what's the problem now? Just hand me over this drug. No, but it's going through a process. Then we go to step 4. Now, after you've checked, here's the prescription, here's the drug that has been well packaged, prepared, and labeled. Please, step 4. Next slide. Once you've done all of that, you still want to double check, right? That's step 4. Please, next slide. Copper, that when I was serving in the hospital, there are this, once you prepared medicine, because the need for a second level check, what we call please, well, in step 4, an accuracy check. What we used to do is, that time I remember, because we're young pharmacists, once we finished, we just pack everything that we've done and we go and meet a senior pharmacist. Literally, you pack everything and you go and drop on the table of a senior pharmacist that has been there. And so what they do is they check, okay, is the name, the way you labeled it, is it correct? They do another level of check just to sure that there are no risk, right? That was the practice during the time I was in the hospital. But now we even have advanced systems. If you've gone to one of the hospitals, you'll see that it has even gone advanced. There are places where there are barcode systems. You know what a barcode is. For example, if you go to a supermarket, there are these barcodes. There are these, how do I call them? Like stick-ons that is placed on the pack of any product that you can use to scan, and it would give you the basic information about that product. It's a technology that helps to label, track, verify, and just basically manage products. So medicines are not an exception. There are pharmacies that adopt, and hospitals that adopt the barcode system. And so once you've prepared, you've labeled, you can always use that as the accuracy check using the barcode. Once you run it through, it would show you if the right drug was given, the strength, if it's correct. It will give you basic information because that has already been built into the software, the managing software within the pharmacy. So it provides that last accuracy check, which is very, very, very important. Once you've done the accuracy check, or a senior pharmacist has said this is good, they pass it on to you, then you go to step 5. Please, let's go to step 5. Good. This is my favorite part of the process, where you dispense to the patient. This is where you take your time. It is very, very, very important. This step. This is where you connect even more with the patient. At this point, you confirm the patient's identity again. You look at it. Are you blessing? Say, yes, I'm blessing. Okay, this is your drug. You hand over the medicine to them, giving them clear instructions. So this process, depending on the size of the hospital, can be divided. There are some places where somebody else will give you the drug, then they will direct you to somebody else, another pharmacist or another corner, where you would go and you will get instructions on how to administer or make use of the drug. Either way, at the point of dispensing to the patient, it is important that you interact with the patient. It is important. You hand over you must cancel the patient. You talk about, this is drug, this is not the drugs, what I'm giving you, this is how you use it, you take it orally, or it's an injection, you get someone to inject you in the morning, in the evening. Please make sure you store this in the refrigerator. No, this one has to be stored in a place where there is no access to water. No, this one cannot be stored where there is too much light. It's important you have that conversation. Then lastly, side effects. You have to let the patient know that, no, if you take this drug and it's looking like you're having, some drowsiness, it is okay. It is all right. You're just reacting to the drug, and, it will wear off. So this is, where you have time to interact and take questions, which I think is very, very important. Make sure the patients understand how they're supposed to use the drug. Then I think you will be basically fine. Once you've done that, you must document what has happened. And so you go to step 6. Just like any process or any system within the hospital, even as a dispenser or a pharmacist technician, you would have to document properly what has happened. Yeah? Pharmacy have lots of records. Even within the pharmacy, you will have to record or put the person's name, if it's either how you call it, hard copy, manual, or electronically. Either way, you have to put the records. Okay, we're giving this patient, you enter all of that information. It's very important. If controlled substances, for example, we're giving, you will have to, I think that one is even a legal requirement, that it has to be documented. You want to make sure, why do you even document? You want to make sure that if anything happens, it can be traced. Want to be sure that, okay, this drug was actually given at so time by so person, and all of that. It's important that you're able to trace. Then it also helps with accountability. It helps with reconciliation of stocks within the pharmacy, medicine and stock. So it's needed for audits. Just like any system, hospital also go through audits, and pharmacy is one of the places they audit a lot, because there's so much money there. So hospitals do a lot of audits in the pharmacy, and so your record will help you in ensuring that you're accounting and you're being a good steward of the drugs that have been, issued in your care within the pharmacy. And so I think we're going to the last step after you document. Next step, please. Next step, please. Next step. No, no, step seven, please. Step seven, yes. Step seven, patient counseling. Um, a classic situation where this, applies, not in most cases, but one of the places where you see this apply is where, you know where there are different segments, with when the patient's case is one that will require special counseling. And so after it moves from the pharmacy, you move to a counselor. Maybe the person needs, there are special cases, maybe there are some form of nutritional needs, for example, that the patient is supposed to adhere to. The patient moves either to a nutritionist or someone to provide some counsel. Maybe there are some lifestyle, adjustment changes that the patient needs to make. They go to where they'll be cancelled. And so this is, not all patients get to this step, but in a number of cases there's a need for counseling. Again, at that point you treat how to use the drug, do's and don'ts, side effects, any other requirements that are needed to support the treatment will be provided at that state. Okay, so these are the one, two, three, up to seven steps that follows an ideal dispensing process. So you can imagine that when you go to a technician or a pharmacist that follows all of these steps, you spend close to 15 minutes in the pharmacy or even more. So that's, for now, this is where I will stop, and I'm happy to take questions and reflections from all that has been said, and any contribution from anyone is welcome. Thank you. Hope I wasn't too fast. Any questions? Is it too much for one day? Hmm?
Thank you, Doc. Maybe I go first to
Okay. Thank you.
ask a question. Thank you. This was very clearly delivered, and I think the pace was just perfect. I'm asking this question for our students. Um, at the beginning of the dispensing process and towards the end, you did mention um, that confirming the identity of patients, presenting the prescription is really important.
Mm.
But I just want to ask, is it um, okay for somebody to present a prescription on behalf of somebody? Say we come to the hospital and have an elderly mother who got the prescription and are assisting her. Can I go to the pharmacy and present the prescription on behalf of my mother while she sits in the car or somewhere? And in such a case, um, as the pharmacy technician, how do I go about confirming that identity? Over.
Okay.
Thank you. Thank you so much.
Thank you. And that's a very valid question, because a number of times, even, there are cases, especially when you come into the hospital with an emergency. Maybe either the person is unconscious, or the person can't walk, either it's an accident, the patient is incapacitated and all of that, yeah, there are exceptions where, someone else can actually take, the prescription. But the easiest thing is to, from the name, if you confirm the identity, you would know that it's not the same person. And so it's important as a technician or a pharmacist, you take a minute to find out why, it's not the person that is present. And in most cases, you get that information. If there are doubts, if you have a doubt, if you have a need to want to confirm, if there is an attendant within the pharmacy, if it's not too far off, you can send them to go. But that's in extreme cases. But there are exceptions where either the patients are unconscious or involved in an accident, or even on admission, on a hospital bed, they can't come to the place. For such, you actually have the nurses or the ward attendant, go to get the drugs, but for such exceptions, there are standards and steps that will be followed to authenticate the identity of the patient. Yes, but it's just not unusual to get such situations. Thank you.
Thank you, Doc.
Okay.